Now I want to welcome Bohra for presenting his work in India.
Thank you. Welcome to all. So I'm from India. Is a migratory ground of vulture conservation, vulture population. So today I presenting on Raptors mortality issue from the northwest Rajasthan from last 5 years. I try to incorporate data from before last 5 years, from 13 to 17 also. So I am and my colleague Dr. Mahasingh on work on that on vulture protection, and we try to work on that. So in India, most important areas, Thar Desert. So Thar is the most important areas from India where 6 vulture species are coming in winter, in particular Rajasthan and Gujarat side. Yes, all population are distributed in another areas also, but despite of this, not only in Rajasthan, including the Pakistan, Sindh and Punjab prant of Thar Desert, also maintaining to around 60 to 70% vulture population. So despite of this species, a lot of agencies working on that, and yes, our government of India is doing well works on that. So this is the vulture migration in Asia, like our colleagues and Vladimir is working on that, and first year two vultures come in our Thar Desert, and from another study is done by BRCC and RRCN, vultures come here. So we just discuss on that migration path from the different areas to come from the flyways from that. So this is not over line of migrant. This is the Thar Desert vultures migrant from the breeding to nesting ground. So it is studied by BRCC and RRCN. So it's the most hot spot of vultures from Indian side. Yeah. So it is vanishing vultures issues from northwest Rajasthan is basically due to veterinary drugs. All we know about that, but when we have look in the data about some nesting population around in 2003, nearly more than 40,000, and now 2015 population of is only 18,000 population, due to the factorial force of four drugs, including diclofenac, aceclofenac, nimesulide, and ketoprofen. So from last year, we analysis some cases in 2019 and 20, around 307 vultures dead due to NSAIDs, and 200, more than 200 in Maharashtra, 120 from the Jaisalmer, and 100, more than 100 from Asar and Sikandargarh in Gujarat. Some cases also done. So is a territory where vultures has come from the Central Asia flyway, and we reported frequently the mortality from the veterinary drugs. We just look in one point, the list of drugs from the availability on market for the livestock population, including to meloxicam, teformic acid, carbapenem, flexine, nimesulide, aceclo, keto, and diclofenac. So all works with the help of Walter and Carey and RSPB, and also BNS is also doing very well work. So Government of India has banned 3 drugs: diclofenac, ketoprofen, and aceclofenac, and rest of this nimesulide maybe government assess the ban or remove from the livestock population. God, we pray to remove it as soon as fast. So now today I discuss on role of NSAIDs for livestock population, because as we know from the Central Asia, everywhere the veterinary drugs are available, but it is really need to remove the issues, because this is the one part, vulture is the one part, but the livestock treatment is the another part of the our society. So veterinary non-steroidal drugs are used for the treatment of livestock population, and this is the helpful for animal recovery during the several cases due to redness, warmth, and swelling, and pain, and inflammation area. But due to NSAIDs, all vulture species drugs are the toxic of 8 species of vultures, and same is non-toxic for the Aquila also. So 2013 and 14, I work on that, and mortalities happen in Bikaner. So a lot of birds and steppe eagle motile due to diclofenac. So I want to discuss with all of you on diclofenac action. So what is the diclofenac? Diclofenac is NSAIDs whose act with COX-2 plasma. So what is the mode of pharmacokinetics of diclofenac or another NSAIDs is the most important thing to all of vulture working groups. So diclofenac is used 1974 for treatment of problems of cattle due to some things and some serious disease. Yes, definitely European Commission in 2004 is warned to this issue about remove the diclofenac. So this is the working of diclofenac. It's very important because anti-inflammatory drugs are attached with COX-2. Beside of this, COX-1 and PLA2 and inhibitor of COX-2, a lot of things are there in the cell plasma. So diclofenac is attached with COX-2, and they go with several sub byproducts. And the processing of the drugs with low levels of potential side effect of gastro problems, cardiac and kidney problems, CNS and cancer also. So the information of some drugs are literally is very important to understand why the vultures are affected from the all drugs. So diclofenac is a molecular structure, is attached with COX-2 and MMPs, and attached with some fibrosis and inflammation areas of normalized circulation functions. Diclofenac is bind with extensive plasma albumin, and the area of plasma concentration type is AUC, is a diclofenac potential to dose of overdose 25 to 150 mg. So below the level of 25 mg, I think this is a good for all of raptors, but more than concentration of 25 of NSAIDs is like, and route of elimination is mainly to total dose of 60 to 70% from the urine and 30% from the fecal samples. So I'm showing the very good a comparative accounts of 4 drugs comparison. Like diclofenac and aceclofenac is almost same. It is a molecular structure of diclofenac is removing of one H, and they have attached with OOH. So is made of aceclofenac. So it is the same formulation of diclofenac and aceclofenac, but in another case of ketoprofen is highly conformation of L-lysine and L-lysine is another mechanism to impact of gout in our vultures population. In NEMU slide, the thio groups of SO2 groups are affected to steroidal impact on kidney and livers. So lot of pharmaceuticals companies are working on changing the modules, but at least we need to think recompress the solution of NSAIDs for the raptors species, all of the migratory species. So from India, in 2006, diclofenac is banned. Yes, in India, one problems again rise. So, Government of India and the Human Rights Commission is ban of human multi-consumption diclofenac ban also in India 2015. And yes, CMS also already issued the letter to all of government against the diclofenac. Yes, this is the good achievement from our Indian side. So in last 1 month ago, in July 2013, Government of India is ban of aceclofenac and ketoprofen and their formulation for the animal uses. So, but it is not effective because 1 month is only goes pass out. Our studies main object is the population status of mortality databases from our area to find out relationship veterinary drug utilization, treatment, and their impact. Find out the local migration monitoring for the food and correlation livestock population, drug uses of animal treatment with the concern of stop mortality, STAPI, and evaluating any poisoning, any issues. And yes, most important, to maintain good practice feeding management to dead animals and forest and municipal cooperation in our site. So this is my area, is the Bikaner, is the saturated in the northwest position and nearby the Pakistan and nearby the Indo-Pak border. So we are is a huge population in this particular population, but we are working on that, this particular areas. If you see why the Indian peoples are using so many diclofenac or veterinary NSAIDs for the animal treatments, the answer is that the population of livestock. So India has kept a good number of livestock population of bovine calculation. So only more than 50 to 60% population cattle and buffalo for the milking purpose to maintain the livestock population for the feeding. This photographs from the Jodbeed. This is the carcass dumping yard. Look here, every place we have put the dead animals. This is a photograph from the Jodbeed during the lumpy outbreaks when the Indians livestock population is totally go down, and the all recently in winter all dead animals consumed by the vultures, migratory vultures. So it's the huge big site. If you look which NSAIDs are available in our area, the ketoprofen, analgin, phenylbutazone, nimesulide, meloxy, telphonic, meloxy paracetamol. I'm showing this slide because companies not issue the single formulation. They produce combination like meloxy and paracetamol, nimesulide paracetamol, mefenic acid paracetamol, aceclo and paracetamol. So this practice is confusing for our Indian side. So the huge number of misprinting. So is all available in the market. This is population from our side. As I showing the last second vulture conference, Eagle conference. So in 2016-17 population is high peak in January is more than 5,500 population, total population, including 6 like the scenarios. Major one is the scenarios, Eurasian, Himalayan, long-billed is almost 0, white-backed almost nil, and Egyptian vulture and steppe eagle is covering to more attention in the particular areas. So as per this year, last winter in 2020-23, so population slightly down in the population of Egyptian vulture to compare with January. Steppe eagle down and Egyptian vulture is rise the population. It is real fact to factor of mortality like food contamination, electrocutions, train hit, pesticide, dog bite, and veterinary drugs. So I will show something is a very horrible, but it is fact from the central this migration ground. This is the mortalities from over a plane. This is only I'm not talk anything. I'm just changing slide. Just changing slide. You just look it. I just want to one question from your side, because this is not a way of talking, but I just try to how to stop such thing of mortality. Because it is very tough work to remove such of things. So anyway, yeah. So I discuss on this table as last when I come here in Russia. So I show this only table, and this year I have this table. So king vulture is no anyone, and Cineris vulture we found from last 5 years 19 birds. Eurasian griffon we found 167 motile birds. Himalayan griffon 39 motile birds. No long-billed, no white-backed. Egyptian vulture is highest one, is 529 birds are dead, and steppe eagle 231, and black kites Malvis is the 37. So total population is 1022 birds from last year, and this one is from last 5 years is more than 200. I just want to okay, we just discuss on that later on. So without any intervention, I'm just to incorporate some views of Egyptian vulture impact on NSAT. I'm talk other than the diclofenac, because in India diclofenac is banned, and in our side no diclofenac availability. So I'm just using to that. So in February 2021, in primary examination mortality due to some contamination of high uses of veterinary drugs of animal treatment. So diclofenac is so in a part of my side, diclofenac testing is not possible. So we analyze only histopathological of kidney or livers on available dead parts. So when I just looking this site, so we found a seems like gout, but I'm not confirmed. So we going with some histopathological some works. So short of areas are purple dotted. So hemotoxin and eosine stain or microsection of kidney develop tubules necrotic fitted or epithelium. So like in renal tubular necrosis, RNT and deposition of urate crystals are available. The amounts and quantity we don't know, because I'm not able to do in our part, but it is very hard to analysis to available uric acid. So the necrosis are available in a part of that. So concluding that the diclofenac, other than the diclofenac of subadult Egyptian vulture, could lead to vessel gouts or similar case of slug out of adult birds related to tolerance of diclofenac toxicity, young birds related to increase of tolerance of COX-2 drugs, because most important facts on COX-2. So increasing of age, a part of whistle gout, like many of peoples are told them adult birds are not affected to veterinary NSAIDs, because the birds able to tolerance capacity of COX-2 in the plasma membrane. So maybe it's a remarkable difference according to age and sex. Thank you.